Hi guys, this is Michaela, and I'm here with Taylor Parks and Shelby Sarnowski, and this is Discovering Who I Am, a group protocol based on the developmental frame of reference. The developmental frame of reference, as implied by the name, discusses how an individual progresses developmentally and how one's priorities will change over time. In addition to a person's priorities changing, their occupational performance patterns are likely to change as well. One thing to keep in mind in reference to the developmental frame of reference is that age is never an accurate measure of development. Instead, age can help group clients into categories of normal development, but should be used as a minor factor. Rather, it should be based on one's functional ability and how they compare against their peers. One particular developmental theorist, Erikson, outlined 8 psychosocial stages of development. We are going to be focusing on Erikson's stages of development in this PowerPoint. Each of Erikson's stages focus on age-related conflicts that help guide our daily life choices. In our group protocol, we are going to be looking primarily at Erikson's stage of adolescence. In this stage, Erikson defines adolescence as identity versus role confusion. In addition, this stage is based on individuals who are aged 13 through 22. People in this stage are in search of an identity that will lead them into adulthood. Oftentimes, they are looking to answer the question, who am I? And one important life event during this stage is developing peer relationships. Adolescence can often be thought of as a transition period. This may be a transition into high school, a transition into college, or possibly a transition into your first career. For our group, we have designed it for young women aged 13 through 16 who are about to or have recently started high school. This group is appropriate for females who are having difficulty socializing due to trouble with self-identity. This group may be beneficial for individuals dealing with social and/or psychological issues. This includes issues such as depression, anxiety, or an overall fear with socialization. In our group, there should be no less than 3 members and no more than 8. Several personal topics will be discussed over this group, therefore it is limited to females only. Additional members may not join this group after the first session takes place. We decided to make this a closed group so that the members within the group would begin to develop relationships with each other, and that they would not feel uncomfortable if a male or a new member joined at a different period in time. The purpose of this group is to promote self-discovery and identity for teenage girls who are adjusting to the transition from middle school into high school. It will allow group members to become more physically, emotionally, and socially confident with themselves, which will allow for a comfortable transition into the next stage of their lives. Through written expression and participation in group discussion, this group will help young women identify who they are and who they wish to become.
Moving on, we are now going to talk a little bit about our introduction of our group protocol, starting with our warm-up activity. And for this warm-up activity, what we are going to do is have the participants at the end of each group meeting, they will be presented a question and then asked to spend around 5 to 10 minutes at home journaling about it. And then at the start of every meeting after that, the participants will share their answers to the rest of the group as a warm-up activity. Some examples of these questions might include, what are 5 things that you cannot live without? What do you think is unique and special about you? Or possibly, when do you feel most like yourself? The occupational therapist will also want to set up the mood for the activity, and this should be a nice, warm, and open environment. The mood should also be very happy and upbeat so that members feel comfortable enough to share their feelings and thoughts. The OT might also play soft music during the activity or use candles to make the room feel more comfortable. And the expectations that the OT has of the group members is that each participant will be encouraging of one another, and it is also important that no one feels inferior and that everyone is comfortable. And second, everything shared during the group meeting should be kept personal and private. The group provides the opportunity for members to share personal information, and that information should be kept private, and this ultimately encourages trust and builds friendship between the group members. And lastly, the group members will do their best to attend every session. If they will not be able to make it or be late, the group leader should know in advance. The occupational therapist is also responsible for outlining and defining the purpose of each group session. And for this particular activity of creating a collage, the occupational therapist might say something like, "Today we will be doing an activity that will help explain what your interests are. And the main purpose of this activity is to give you all a chance to get to know one another better and to see what likes and dislikes you might have in common. I will give you around 45 minutes to complete this activity, and then after you finish, you will get the chance to share your final outcome with the group members and talk about what you." For the timing of the group activity, the group will meet once a week for a total of 6 weeks. Each group meeting will take around 1.5 hours, and this particular group session is outlined below, and it would start off with the warm-up activity for 15 minutes, followed by the actual activity, which is making a collage. That will take around 45 minutes. And then at the very end, the group will be given 30 minutes to share, process, generalize. The therapeutic goals is something that is always set prior to each group session and also discussed with each group members. And for this particular group activity, the 2 goals are to identify trademarks that represent your personality and to create connections between yourself and other young women who are going through similar life experiences. Moving on to the actual activity, each group member will be given several different age and gender appropriate magazines, as well as a large sheet of construction paper. From there, the group members will flip through the magazines to find various words or pictures that might describe who they are. It can also represent their interests, their family, their friends, values, or their personal likes or even their dislikes. The group leader will also encourage members to construct a collage by cutting out these images and gluing them on the construction paper. The OT should also let the group know that they can be creative as possible with how they structure their collage, and it's also useful to create a title because it might tell them a little bit more about themselves. Then, after completing the collage, each member will have time to share their posters with one another in order to make connections about their values, beliefs, or even their likes and dislikes.
The equipment that is needed for the activity would be age and gender appropriate magazines, construction paper for the actual poster, glue to glue the images onto the poster board, and scissors to cut out the various images from the magazines. Based on the therapeutic goals of the group, we focused in on some occupational needs. These include social participation, education, and leisure. So members of the group may be struggling with socialization, and through this activity and the sharing of their posters, open discussion and self-identity will be encouraged and help make group members feel more comfortable around people of their age and gender, which will help in the transition process into high school. So the goal of the OT is to help make them feel more physically, emotionally, and socially confident as they're making this change into adulthood. So this can be done by encouraging interaction skills and relationship development skills between the group members. So once they are more confident in terms of socialization, this can also extend to their educational environment. By overcoming the social and psychological barriers, we hope this will increase participation in school or in extracurricular activities, as well as between classes or during lunchtime, so anything overall in the educational environment. In terms of leisure activities, open narrative and self-discovery activities are used to explore past, present, and future interests, which all make up a person's identity. So by going through the magazines and cutting out different images, this can reveal a lot about their past and present, and as well as spark new interest to maybe things that they want to discover in the future. So all three of these things kind of interact and encourage each other in terms of occupational needs to reveal a sense of self and self-identity. So we have some evidence to back up our activity and the effectiveness of it in terms of identifying yourself and self-identity. So according to the American Psychological Association, making magazine collages can reveal an effective way to assess an individual's symptomology. And they can also be used to predict behaviors or make inferences about characteristics of the person. So after analyzing what you made or what the group members make, it may pose as a way to really get a good grasp of who the individual is in terms of their personality or what they value or what their interests are. And then talking about these, what was chosen for their poster, can also kind of get an insight of self-discovery. Another article focused on implementing creative tasks and discussing stories through narrative. And this kind of open discussion can help uncover occupational identity and give a better sense of self. This theory can be applied across the lifespan and also translate into other developmental psychosocial. So that concludes our introduction portion to our activity, Discovering Who I Am. Tune in to the next video for parts 2 and 3, which have the actual activity and the debriefing process. Thank you!